Hello dear friends, my name is Dr. Igor Atabekov. I am clinical oncologist practicing since 2010. So, let's start about unofficial protocol that is called Makis protocol. Makis or Makis, I'm not sure, I'm sorry, I'm not sure how to read correctly this surname. Especially I'm not a native speaker. Dr. Makis is a doctor from Czechoslovakia that immigrated to Canada and graduated from medical school there. He was a practicing oncologist working in nuclear medicine field, meaning they used these special little radioactive substances that went directly into the tumors that were spread in the body. He was working with neuroendocrine type of tumors. And these tumors, they specifically accumulated these radioactive substances. They stayed there and they were spreading radiation and killing these tumors. Dr. Makis, I'm sorry, said that they had a good progress in treatment of the patients, but unfortunately he had some problems with government, with official system, and finally he lost his license. It's not my purpose to figure out what was going on there. I'm interested in scientific part. This doctor, he recommends, first of all, metabolic approach, starting from keto diet and 72-hour fasting. Again, we were talking about metabolic mitochondrial theory, talking in details, why it may work, what are the problems, what are the real patient cases using this approach in order to starve the tumor. And this doctor, he used preclinical studies that we talked in the first video, and he developed his own protocol of how to treat cancer patients. Of course, this stuff was not appreciated by official medical community because there is no enough data on dosages on how to use these drugs. And of course, you cannot recommend this if you're working as a doctor. You will lose your license. The only thing you can do is just to show articles and to try to discuss it, what they found out, but you cannot totally say that, oh, okay, this is for sure, this will help, don't do any chemotherapy. Especially, as I always tell you, that the best approach is to attack tumor from different sides. Not only keto diet, not only some drugs, not only, I don't know, curcumin or medicinal mushrooms, but from different sides. And every patient has its own case, its own situation, its own type of tumor, its own problems with maybe immunity or genetics. And there is no single approach for everyone, nothing universal. And that's the problem. That's why we need clinical trials. So again, what made Dr. Makis, by my opinion, make this protocol? He found several cases. Look here. Stage 4 kidney cancer. Improvement when the patient used Ivermectin and Mebendazole after failure of usual official treatment. Ovarian cancer. Drop of ovarian cancer marker. This is the substance that ovarian cancer produces often, and we monitor the effectiveness of our treatment by this marker after only 3 weeks on high-dose regimen of Ivermectin and Mebendazole. But by the way, ovarian cancer is very sensitive to chemotherapy, especially at the beginning. You can often see the total disappearance of the tumor, even it's widely spread when we start chemotherapy. Of course, afterwards, in years or months, it can come again, we treat again, come again, treat again, and it becomes less sensitive because the tumor's resistance grows. Next, stage 4 pancreatic cancer. They say he was given 3 to 6 months to live. He started Mebendazole protocol. There was no spread or growth of tumor, so it was stable. And his, again, marker of this tumor dropped significantly. Meaning that cancer did not go away, but it was not growing. This is also the result because pancreatic cancer is not usually well treated with chemotherapy, but chemotherapy can also cause such stabilization of disease, or even sometimes it becomes smaller, but then it eventually will grow. That's why, again, it's a case. Breast cancer with spread to bones, was taking Mebendazole and reported being cancer-free. Colon cancer with metastasis in the liver, decrease in the marker of this cancer. and as I understand was taking chemotherapy also. And when started ivermectin with mebendazole, all the side effects were gone. And the other patients who reported improvement when taking ivermectin, mebendazole or mebendazole. Again, these are reports of separate patients. We don't know actually what helped them and what kind of tumor that was, what actually led to the improvements. And some were with together with chemotherapy. That's why chemotherapy may actually sometimes help to completely get rid of the tumors. Some of them are very sensitive, like for example ovarian cancer. And Dr. William Makis, he offers such dosages. This is ivermectin dosages, less than 0.5 milligram per kilo, if there is remission, to decrease the chance of recurrency, or if there is a strong history of cancer, genetic predisposition. And here is the example: stage 3 ovarian cancer, chemotherapy plus ivermectin, and tumor vanished after 2 months. Again, chemotherapy alone often does this, so that means nothing. But maybe ivermectin worked in this case. I don't know. We don't know. Nobody knows. Maybe it's a coincidence. That's why we need clinical trials, of course. Next, 1 milligram per kilo. Big, higher dose already for most of cancers as a starting dose. Here he talks about a patient with prostate cancer. After 2 months, his PSA, it's a marker of prostate cancer, it dropped, and it was given in combination with lactoferrin. I'm not sure if he was getting also hormonal therapy, because it's very effective in doing the same. But anyway, combinations are often better. That's why maybe hormonal plus ivermectin will work very well. We still need to learn it in clinical trials. Next, higher dose, 2 milligrams per kilo. This is for different fast-growing cancers, like, for example, acute leukemia or pancreatic cancer, very aggressive and fast-growing, or brain cancers like glioblastoma. Here they talk about the stage 4 gallbladder patient. Gallbladder cancer is very aggressive. It's like pancreatic cancer, kills very fast, and chemotherapy is not very effective. 2 milligrams per kilo per day for 14 months, and cancer disappeared. Well, to be honest, I never saw gallbladder cancer to disappear on any chemotherapy. That's why this is an incredible case. And very, very high dose, if it's a very bad prognosis, a lot of cancer everywhere. And they report a possible transient adverse reactions like visual problems. Okay, what is good about this protocol? Yes, it has some data, it has some even case reports, and it gives hope to many patients. Especially clinical trials take many years until they are done. Many patients don't have time to wait. That's why this protocol is good, but it's unofficial because it doesn't have enough clinical evidence. But let's talk about what we know, what clinical evidence we already have. This study was on healthy adults, and they were seeing how much ivermectin can be tolerated. And they said that, okay, even higher doses that is usually used against parasites, you can see here, up to 120 milligrams single dose was well tolerated in healthy adults. Also interesting article, continuous high dose for a long time in patients with leukemia, acute leukemia, was quite well tolerated. In 2015, there was the phase 1 clinical trial on breast cancer patients, and they were understanding what maximal doses are tolerated for cancer patients. Because one thing is for parasites, 12 milligrams is usually used, and it's enough. For cancer patients, it may be more needed. But unfortunately, no results were posted. There are 2 more clinical trials now. They are still recruiting. And it's good news. You see that the scientists, they see the potential of these drugs. This is phase 2 clinical trials on patients with colorectal cancer. They're still recruiting, and it will be done maybe at the end of 2025 or even later. And one more on patients with glioblastoma, very aggressive tumor of the brain. They're still also recruiting, and the estimated time of completion will be maybe 2026. Let's talk about mebendazole. They are trying to understand the maximal tolerated doses in patients with glioblastoma also, and in patients with gliomas, in kids with gliomas. You can see here the number. If you write this in Google, you can find this study. It's phase 1. Here it's given twice for up to 70 weeks, different dosages here, and may be given together with some standard drugs for these tumors like bevacizumab or irinotecan. You can pause and watch this if you wish. One more study here, you can see estimated completion will be 2027. Metabolic treatments for patients with cancer. This is against brain tumors, no results posted. You see all the studies, all the study numbers. You can pause and watch them in more details. This study I talked about for prophylactic chemotherapy after cancer removal, together with chemotherapy in colon cancer patients, will be done in 2028. And by the way, there were some posted clinical trials. For example, one was on colon cancer patients that was already highly spread with metastases and chemotherapy was not working anymore. But in some patients, the tumor stopped to grow. And it's already a good result, especially this tumor was already very trained by a lot of chemotherapy drugs before. And one more study on patients with cancer of the adrenal glands with a lot of metastasis also, when usual treatments were not working, but it did not show any effectiveness. Maybe because it was used alone, or maybe it's not a kind of tumor that will be sensitive to this kind of drug. By the way, there was interesting case report, a 48-year-old man with such kind of adrenal tumor who tried already radiation therapy, chemotherapy, targeted therapy, nothing is working. He was started to take mebendazole, 100 milligrams twice a day, only mebendazole, nothing, no combinations, and he was stable for 19 months. Unfortunately, afterwards, after 24 months, he became worse. That means this tumor most likely gained resistance to this drug, to mebendazole. But if he used it in some proper combinations, who knows what would happen? Maybe he would be already cancer-free. That's why, as you see, there are a lot of clinical trials. Most of them are very early. They are just talking about the doses. But there are already some clinical trials ongoing that are determining the effectiveness of these drugs. So it's already good news. And what can we say about dosages? In the standard doses of 12 milligrams per day, as is used for parasitic infection, ivermectin was well tolerated even when taken for a long time. And cancer is treated for a long time, we know that. Mebendazole, one phase 2 clinical trial tells us that doses up to 4 grams per day may be tolerated by cancer patients. However, it did not really help these patients with gastrointestinal cancers. But don't forget, it was already highly treated with a lot of different combinations of chemotherapy drugs, and maybe mebendazole alone is not a good choice to treat such kind of very aggressive and strong cancers. Combination is needed. But for now, mostly mebendazole is taken 1 to 200 milligrams per day, meaning 100 milligrams once or twice daily. But again, these are unofficial doses. Clinical trials are still ongoing. This is the trial I was talking about, up to 4 grams per day. Unfortunately, after 8 weeks, all 10 patients, they showed that the disease continued to grow. But there were no severe adverse reactions even with these high doses. Okay, adverse reactions. Both of them may cause gastrointestinal problems like diarrhea, vomiting, nausea, some abdominal pain, some bloating. Both of them can cause skin reactions like rash, itching, can cause allergies. Very rarely it can cause some serious allergies like anaphylactic shock with drop of blood pressure, but actually anything can cause that. Ivermectin may cause some brain problems like some dizziness or fatigue or headache, and rarely it can cause something more serious like tremors and even confusion and coma, but it's rare. It can cause some visual disturbances, and of course if person has a lot of parasitic infections. I was talking about just common adverse reactions before without heavy parasitic infection. That means I was talking about for example, cancer patients who take it unofficially. But if the patient has a lot of, for example, lower filariasis, or if it has some river blindness, it may actually cause very severe adverse reactions because of massive death of these parasites, like fever, swelling lymph nodes, like swelling of face, extremities, skin rash, itching, even sometimes tremors or coma. But again, this is for severe parasitic infections. And one more thing, of course, we know that these antiparasitic drugs may cause some liver toxicity, attack to liver. That's why we always need to monitor their liver enzymes in blood, like LAT, AST, but severe liver toxicity is rare. If we talk about adverse reactions of mebendazole, we talked already about GI and skin, about allergies. Also, it can cause some liver toxicity, especially when taken for a long time or very high doses. Rarely it can cause the damage to bone marrow, causing low white blood cells, and it can cause some also dizziness or headache. Also skin reactions and can be sometimes very severe, but it's very rare. In pregnancy, both of drugs are better not to be used in the first trimester and a little bit more safe in the second and third trimester. Better not, but if they say benefit is more than potential harm, then it can be used. Don't forget about drug interactions. For example, with cyclosporin, ivermectin may be quite dangerous because they both block these canons, P-glycoprotein, and this may potentially cause increased toxicity to the brain of ivermectin. That's why always discuss the interactions between drugs you're taking with your doctor. And also mebendazole, for example, with metronidazole, it may cause severe skin reactions, or with cimetidine, it can actually block some factories in liver that may degrade mebendazole. That means if it's not degraded, mebendazole will grow high and it may cause its high levels in blood and potential toxicity also. Don't forget to monitor your liver function tests, your blood count to see your white blood cells, red blood cells, platelets. And of course, don't forget that they are not approved nowadays officially for cancer treatment. Mebendazole is not studied in kids, in infants, less than 1 year old kids. And in breastfeeding, yes, they get into the milk, but both of them are considered potentially to be safe for infants, for breastfed babies. And if somebody has pre-existing liver problem, if somebody has problems with bone marrow, their blood cells are low, that may be also an issue. And be careful taking these drugs together with other drugs that affect liver. Dear friends, that's all for today. Thanks to everyone who supports this channel. If you want to join them, please watch the link down under this video. You can buy me the coffee or become our sponsor. Please share this video with somebody who may need it, and I appreciate if you share your experience. Maybe you know someone who was using these drugs. It's always interesting to read this. And I see you in the next videos. Goodbye.
Don't be afraid, doctor.